Good evening, everybody. Can you hear me?
Yeah.
Yes, no problem.
All right, I'm going to start. And if for any reason you can't hear me or anything, please let me know.
Okay.
Today, I'm going to talk about a topic that I'm deeply passionate about, diabetes type 2 and its treatment with homeopathy and alternative methods. At the start of the 20th century, infectious diseases were the primary cause of death and disease. Pneumonia, tuberculosis, gastrointestinal infections were some of the main ones. However, improved public sanitation and breakthroughs in the development of antimicrobial agents completely changed that picture. Many of these once formidable infectious diseases now became easily treatable. By the 21st century, diabetes, cardiovascular diseases, and cancer became the main causes of death. With the explosion of knowledge in the field of genetics, the power of our genes became very clear in our susceptibility to diseases. However, genetics alone is not the primary cause for the meteoric rise of these modern diseases. Our unlucky genes are not always to blame. Modern lifestyle choices derail many metabolic processes. Poor diet, disrupted sleep rhythms, excessive consumption of substances, and other such factors create a misalignment between the dietary and environmental landscape humans are physiologically adapted to and the ones we choose to live in.
Yes.
A fertile ground is created, we could say, for all types of ailments. Diabetes type 2, gout, Alzheimer's, acne, thyroid complaints, cardiovascular diseases, erectile dysfunction, polycystic ovaries are all considered typically idiopathic. Yet, the problems of hyperinsulinemia and insulin resistance is far greater than is currently being recognized. According to the most recent publication of the Journal of Insulin Resistance here in the United States, both in medical literature and clinical practice, insulin resistance is primarily discussed only in the context of type 2 diabetes and rarely outside of that. However, a large and continually growing body of literature suggests that insulin resistance is the cornerstone of a unifying theory of chronic disease. The diseases that are stemming from this condition are so vast that they can almost bankrupt our nations. The current treatment paradigm is not working, as we all know, and we urgently need to create a new one that is different from the one currently being used. Today, I'm striving to increase your awareness of this condition and its treatment so we can all target correctly towards healing. To begin with, let's first look at what is diabetes and its origins. We all talk about diabetes prevalent today, but what is it really? The term diabetes is a Greek term and it means to siphon. It was coined in 250 BC, with its earliest mentions dating all the way back to 1500 BC. The disease is characterized by too much emptying of urine with a lack of absorption. Two types of this disease were first identified and named actually in ancient India, and the term translated to honey urine. The word mellitus was coined to differentiate it from the insipidus variety where the urine was tasteless. My focus today is primarily on type 2 diabetes. In 1847, Paul Langerhans identified the beta cells that secrete insulin. They are named the islets of Langerhans. It was only around 1910 that we learned about the existence of insulin. So how many people are affected by this condition? According to the most recent reports released in February 2018, this is in UK, 4 million people are thought to be living with diabetes. 1.9 million are probably going undiagnosed. That's an estimated 6% of the entire population of UK. In the United States, these numbers are even worse. An estimated 100 million Americans are thought to be living with diabetes. Another 7.2 probably undiagnosed. That is thought to be about 9.4% of the population. Now let's come to India. The numbers are significantly higher. 77 million people are diabetic in India. India is the second highest country in the world with type 2 diabetes, China being number one. As of 2019, 12% of India's population is diabetic. What does it cost to treat diabetes? An estimated 14 billion pounds is spent yearly on treating diabetes in the UK. That is 25,000 pounds every minute. In the US, $245 billion is spent annually on diabetic treatment. An average American spends out of pocket $14,000 per year on medical expenses related to treatment. In India, a diabetic spends about 9,200 rupees monthly on treatment. So diabetic mellitus type 2 is diagnosed typically with a glycated hemoglobin test, HbA1c, or A1c as we commonly refer to it. And it indicates a 3-month average of blood glucose. I'm not getting into the levels of pre-diabetic and diabetic because it varies by country, so that I leave that to you. Some of the other tests used are a random blood sugar test, fasting blood sugar test, as well as like an oral glucose tolerance test. So what are the main signs of diabetes? 3 of them: polyuria, which is frequent urination; polydipsia, which is increased thirst and fluid intake; and polyphagia, which is an increased appetite. And the common symptoms: increased thirst, frequent urination, excessive hunger, unintentional weight gain or weight loss, fatigue, blurred vision, slow healing of wounds and bruises, hands and feet that can become numb with pain or tingling, tender red gums with swelling or bleeding. From a pathophysiological standpoint, in a healthy individual, the pancreas are the organ of the digestive system, and they perform the endocrine function of secreting digestive enzymes and hormones, insulin and glucagon, to control the amount of glucose in the bloodstream. The release of insulin lowers the blood sugar, as we know, and glucagon raises it. Insulin levels peak at about 20 minutes after a meal and drop to their lowest about 2 to 4 hours after a meal. Hyperglycemia, or high blood sugar, is a defining characteristic of all types of diabetes. In the past, type 1 was much more common. Today, 90% of all diabetes is type 2. It used to be typically an adult illness, but with increased childhood obesity, this has become an epidemic across all ages. In type 1 diabetes, there is a lack of insulin, whereas in type 2, there is often hyperglycemia. This is pretty much stemming from insulin resistance, which is the body's inability to absorb the insulin and produce the necessary things to digest the food. So what does the body do in response? It produces more insulin, leading to higher insulin levels in the bloodstream. And this is referred to as hyperinsulinemia. Research tells us that this condition often shows up almost 13 years before the onset of most of these major diseases. Insulin resistance develops from the gathering of visceral fat inside and around our organs. So let's look at the phases of this disease. The liver is the first major organ that is affected, and this is called the hepatic cycle. Next is the pancreatic cycle, resulting in a fatty pancreas, leading to beta cell dysfunction. Basically, increased fat leads to decreased energy production, high triglyceride levels, high blood pressure, overworked kidneys from fluid retention. This metabolic syndrome becomes a base for all other health conditions. Research also tells us now that high insulin levels in the bloodstream are far more damaging than the blood glucose we focus on. So diabetes is a chronic disease. It affects almost the entire body. Complications from this disease can affect, just as Dr. Jose was telling us, either micro blood vessels or macro blood vessels. When the small blood vessels are damaged, it leads to chronic diseases of the kidney and eye problems. When larger blood vessels are damaged, it leads to atherosclerotic plaque formation, narrowing of arteries, causes strokes, heart attacks, gangrene of the legs, and other macrovascular diseases. Some of the other possible complications that arise from this are fatty liver disease, polycystic ovaries, skin conditions, Alzheimer's, cancer, erectile dysfunction, bladder complications, digestive disorders, nausea, constipation, diarrhea, orthostatic hypertension, and eventually diabetic coma. For a very long time, BMI and obesity were considered the mainstays for many of these chronic conditions. However, there are millions of people of normal weight who experience these very same conditions. They may be thin, but they have decreased high-density lipoprotein, a larger weight to height ratio. Today, such people are referred to as skinny fat. Research also tells us that the buildup of adipose tissue may be due to insulin resistance, rather than insulin resistance always being attributable to weight gain. In the same vein, obesity is one major marker attributable to insulin resistance. Not everybody with insulin resistance needs to be overweight or have that very same marker. According to World and Global Diabetic Associations, causes for diabetes are attributable to two things: genetics and lifestyle. In the 1950s, we saw an increase of heart attacks. This was probably due to increased industrialization at that time. However, dietary fat was believed to be the culprit. Low-fat diet recommendations began, and this led to an increased consumption of high carbs. By 1980s, 108 million people globally had diabetes. By 2014, that number had reached 422 million. In the past, diabetes type 1 was, as I told you, much more common. But by 2016, only 10% of all diabetes in the world was type 1. Majority of the patients with diabetes today are obese, and the levels of obesity in the world is growing at an alarming rate. In 2009, a famous endocrinologist from California, Dr. Lustig, increased awareness of the harmful effects of sugar. Yet, one key element was missed, and that is fructose. Fructose is not consumed by the body like sugar. It is instead digested directly by the liver. Its overconsumption leads to the formation of a fatty liver, which we frequently see nowadays. Originally, fructose was gained from fruit and considered harmless. However, the advent of cheap, high fructose corn syrup as a flavor enhancer led to most processed foods containing it. Today, research tells us that it impacts the brain in almost the same way addictive drugs do. Limiting consumption seems like the obvious answer, yet this is almost next to impossible, as it's lurking in almost everything commercially manufactured. So reading food labels in a very discerning manner is critical to avoiding this additive. Further, once a hepatic cycle has resulted in a fatty liver, consumption of fructose even from a fruit that was once considered harmless now causes spikes in blood sugar similar to pure cane sugar. Past treatment from an allopathic standpoint of this disease was pretty much just drug dispensation. Today, even allopaths are aware that just giving medicine is not enough. So they give the medicine along with suggestions to lose weight, eat healthy, exercise, though none of these are monitored. As we know, these medications have tremendous side effects. Almost every prescribed drug causes some other long-term problem. Besides, these lower sugar levels that we see in the tests are very superficial and temporary. They are not a cure. That is why these dosages have to be regularly increased. From a holistic standpoint, if you remember, the two main causes I told you from a diabetic associations mention for cause of diabetes are either lifestyle or genetics. This is exactly where I focus my attention in treatment. Let's begin with lifestyle. Most people, when their doctor tells them to lose weight for their health, they start focusing on cutting calories and adding exercise. Even in extreme cases where bariatric surgery has been performed, it has been found to quickly decrease or even reverse the condition of diabetes, as it forces involuntary fasting on the patient. However, when they go off that diet or they stop that exercise, that problem returns fairly quickly. Even after bariatric surgery, 25 to 30% of the participants gradually gain that weight back fairly quickly. What has been found effective is when a patient is able to maintain their basal metabolic rate, both before and after a diet, so they don't return to their old ways of eating. There is a famous saying that I'm sure you've all heard: you are what you eat. The food we eat determines how we look, feel, and function. Whether we sleep well at night, if we are shaped like an apple or a pear, whether our brains will use glucose or ketone bodies to get energy, or for a woman, her chances of getting pregnant. In short, the right nutrients and food combinations will help us live longer and healthier, while the wrong choices could shorten our lives and increase sickness. Chronic diseases and having high insulin levels in our body for a long time causes systemic inflammation. This inflammation decreases enzyme production responsible for breakdown of fatty acids. It is important to bear in mind that this process begins in the gut and then gradually spreads to all other body systems. In diabetes prevention and treatment, maintenance of an ideal body weight is needed. So how do we do that? How do we shed this weight without lowering our basal metabolic rate? To understand what is good health, I turn to the diet of the centenarians in the blue zone cultures: Okinawa in Japan, Sardinia in Italy, Nicoya in Costa Rica, Icaria in Greece, and Loma Linda in California. Although these cultures are very diverse, there is still much of an overlap between them, and there are things we can learn from them. These people were tough. They were fighters. They could survive even the death of a close family member and go on with the desire to live. Some of the factor between these cultures, which really stood out to me, I'm going to share with you today. They pretty much ate a plant-based diet, high in nuts and some fish, diet low in protein, sugar, and saturated fats, a diet rich in complex carbohydrates. They frequently consumed 2 meals a day, sometimes a third light meal. They never ate after dark. They had a lot of physical activity, including walking, gardening, martial arts, and dancing. They did not take on much stress. Instead, they led a life of spirituality, religion, or with a family outlook. They fasted frequently, either for religious reasons or natural causes. These people were tough, as I told you, both emotionally and physically. And one key thing to remember, to notice, is they limited their protein intake. Today, when we want to lose weight, a lot of us turn to so many of these fad diets: Atkins diet, South Beach diet, various diets which tell us to cut out the carbs and eat the protein. However, if we really want to be healthy, we need to be aware that nutritionally, consumption of protein should be between 0.31 to 0.36 grams per pound of body weight. And as we lose weight, that protein consumption needs to decrease. A key aspect that stands out here for good health is fasting. Intermittent fasting on a regular basis and fast mimicking once a quarter. This may need to be medically or nutritionally supervised. Fasting not only helps shed the extra weight, but having these gaps in eating gives the digestive system a rest. Fasting also triggers the release of IGF-1, which is a growth factor that helps with damaged cell regeneration. Regular exercise, ideally 5 times a week, but with the busy lives we need, that's often not possible. I advise my clients to exercise for a minimum of 20 to 30 minutes, preferably immediately after their heaviest meal. If you remember, the blood sugar and insulin spikes literally 20 minutes after we eat. After breakfast and lunch, we are often moving around, so we expend the energy. But after dinner, we often sit on the couch and watch TV, and that's when it collects. Herbs and supplements are plenty. People take them often to manage their symptoms, but none of these are a cure. I'm going to name some of them just for your awareness. Bitter melon lowers blood sugar. Bilberry extract repairs ocular damage. Aloe vera speeds up wound healing. Cinnamon lowers bad cholesterol and postprandial blood sugar. Fenugreek or methi is a digestion regulator. Ginger, gut health and sugar regulation. Okra, gut health, digestion and sugar regulation. Apple cider vinegar with the mother lode for lowering sugar. So there are many such things. The list is long. Some of these herbs can trigger the release of an enzyme called AMPK. This is an enzyme that actually helps regulate the gut and which slows down with age. Release of this enzyme can lower inflammation, which in turn can help insulin. But if you stop this herb or supplement, the levels go up again, and after some time, it doesn't work. The second and very important aspect of treatment of diabetes type 2 is to consider genetics. While many of these lifestyle changes and supplements can be used to lower the blood sugar and what appears to be reverse disease in some cases, in reality, this effect is only temporary. Why, we may ask? Our DNA contains certain genetic information. Although every single DNA present is not unique, the sequence of pattern variation is unique. No two people have the same sequence. Take, for example, the biometrics of our fingerprints. No two are alike. Same goes for the scan of our iris. All are very different. The same way, stressors that affect our life with the problems that we manifest affects our susceptibility very differently. Each of us have our own unique susceptibility. Homeopathy is the only method of treatment that can address these unique individual disease manifestations and work to cure the disease without the awful side effects of allopathy. Homeopathic system of medicine existed from before the time of Hippocrates. Homeopathy was actually first introduced in America due to its success in treating the cholera epidemic of Europe in 1832. Thanks to our great Samuel Hahnemann, homeopathy has spread to many countries. America was in fact a leader in the early 1900s, with 22 homeopathic medical colleges and 15,000 qualified doctors practicing homeopathy. The first full-fledged homeopathic hospital was in Ohio. However, growth of the pharmaceutical industry, release of what is called the Flexner reports by the pharmaceutical industry, and the common man's lure for the quick drug resulted in these colleges and hospitals being shut down overnight. The reasoning being that they didn't meet these allopathic scientific standards. Homeopathy, though, is alive and well in many countries, and thanks to groups like this, we're all working hard and striving to keep our homeopathic flag flying high. Now I'm going to look at some cases that I treated of diabetes type 2 that had fairly successful results. The first case was a man by the name of Brigido. He's 42 years old when he first started treatment. He's of Mexican origin and works in the construction industry. His wife and daughter were actually patients of mine and had wanted to bring Brigido for quite a while, but he was really resistant. About 3 years back, I was actually in Trivandrum in Dr. Joseph's clinic when his wife called me completely distressed. Apparently, her husband had been feeling very tired for a few days and thought that maybe he was fighting a flu. He took some time off from work. After about 4 days, he felt the same. So he decided to go see the doctor. Being of a fairly low socioeconomic background, he did not have insurance coverage, also being an illegal alien in this country. So he went into the local government hospital and they ran a battery of tests. Their blood sugar monitor reached a maximum of 500, and that's the level that Brigido's blood reached at that point. If he had better coverage, they would likely have hospitalized him. But because in this case, he didn't have that, they gave him a prescription of metformin and a diagnosis of type 2 diabetes and sent him home. Based on a standout symptom, which to me at that time was a little confusing, Dr. Joe said, excessive thirst. Let's give him Bryonia, 30C. His test results came back with an HbA1c of 10.4. He had very high cholesterol and triglyceride levels as well, and a fatty liver. His fasting sugar, with being very careful after he found out about this diabetes and with his diet, it was around 150 to 160. And his 2-hour postprandial would hover in the low 200s. When I got back from Kerala, I saw him in my clinic and gave him some nutritional counseling along with homeopathy and strongly urged him to get into a routine of exercise as well after dinner. I also learned that his father had been a diabetic for several years and had almost lost his vision by that point. Brigido was a very quiet man. He didn't speak English, and my knowledge of Spanish is broken. So I had to rely on his wife to translate. We continued with Bryonia all the way from 30C, 200C for a few months. Within a month or so, his fasting sugar was down to about 120. His postprandial also came down to 170, 180 range. Within a 3-month mark, his fasting blood sugar came down to 106. And the post meal was around 150. His doctor naturally reduced the dose of his medicine. As he got more comfortable with me a few months later, I discovered Brigido had a bit of a temper, and he held on to past upsets for years. He also added, I was told, extra salt to his food. We changed the remedy to Natramure 30C. With this remedy, literally in 2 weeks, his fasting sugar and postprandial levels returned to normal. Brigido at this point did not ask me or his doctors, but decided to take law into his own hands and completely stopped all his medication. I don't recommend this, by the way. Within the 6-month mark, his A1C had returned to 6.1, and he was feeling completely fine, totally fine. Based on his past test results of liver issues, coupled with his presenting symptoms at that time, I started him on lycopodium. This remedy was used for almost about 6 months. I was able to go all the way up to 1M. Then some skin issues started to surface, an eczema type of rash that I was told was actually suppressed in his childhood with some type of creams, probably cortisone. He also had a very strong craving for eggs with head sweating. We changed from lycopodium to calcarb. For a few months, we continued with calcarb. We went from 30C dosage all the way up to 1M. By this point, he retested all his levels and came back excitedly to tell me that both his cholesterol and triglyceride was now within range. And the fatty liver was also better than before. The only complaint still remaining for him was eczema. As the modalities of this complaint at that time matched sulfur, we gave him 200C sulfur. Initially, this caused some flare-ups. But as Brigido had seen such good results with his treatment, he was a patient sport. He continued with treatment, didn't do anything to suppress the rash. And on his last visit, I've actually given him sulfur to 10M. And this was about 2 months back. And there's been no sign of the return of his diabetes, though he's careful with his diet and nutrition and make sure he exercises as well. For my next case, before I move on, any questions on this case? For my next case, I'm going to look at an Indian woman. I'm going to call her CY. She was 57 years old when she came to see me, and she has Kaiser insurance in this country. This lady was known to me through her son. She works in the tech industry, and her job requires her to be online all the time. Her diabetes had advanced to the level of seriously affecting her vision. She had diabetes for almost 10 years by this point, and she had taken 3 months of disability leave as she couldn't clearly see her screen. On her first visit, this was April of 2017, her A1C was 9.5. She had glaucoma, cataract growth, and fluid collection in both eyes. This was requiring injections bi-weekly. Homeopathic treatment was started along with her allopathic medication. With guidance from Dr. Jose, we started on arsenic album 30C. Her A1C was tested 6 weeks later and was lowered by 1 point to 8.6. However, she stopped treatment because she felt homeopathic remedy was so tiny, it really cannot be doing much. She attributed her improvement in her A1C to her taking her daily walks for 30 minutes and her eating a little bit better. And she also really liked to drink coffee, and I think this was a problem for her. So she didn't want to resume treatment at all. She was gone for almost a year. After about back again, she said, despite her exercise and her diet regimen, her A1C had still gone up. July 2018, on this visit, her A1C was now 9.6. Eye injections for the glaucoma and cataract and fluid collection had increased from bi-weekly to weekly. Glaucoma medication dosage had also been increased. This seemed to be speeding up the growth of her cataract complications. She reached out in desperate help. Feeling really desperate, she was willing to do anything. Thorough reevaluation was conducted and information was gathered. Cataracts were severe. Patient had really wanted surgery, but her doctor refused, telling her her A1C levels were so high that surgery was risky. And until and unless she lowered her A1C, he was not willing to take surgery on. Presenting pictures still called for arsenic album 30C, which is what I prescribed. By the end of that month, July 2018, her fasting sugar tested at 120 and postprandial came to 148. August 3rd, fasting sugar was at 101, postprandial at 140. She was still on metformin. Her doctor told her on July 9th that if she, based on earlier tests that they had conducted, that she may soon need to start insulin. And she was very keen to avoid this happening. Next, she came to see me in October. I realized in taking a case that she had held on to a lot of past grief associated with her marriage and her in-laws. She was very upset with her husband and she was considering leaving him. She talked of getting another house and moving out and things like that. There was a deep-rooted feeling of loss in her life, and she made herself more and more isolated. I gave her sepia, and fortunately, after prescription of sepia, she never left her husband. She stopped talking about that altogether. Since then, there have been many visits with this patient, and going over every detail would take a very long time. So I will give you a picture and a summary at the high level. Basically, her A1C came down over the course of the next 4 months to 6.9. The doctor was willing to perform cataract surgery on her left eye. She recovered well. During recovery time, we treated her homeopathically for some of the recovery, like with arnica and things like that. Vision was restored February 2019. Once this eye was good, she became lazy and disappeared again. I think that not being able to drink coffee with homeopathic treatment was very difficult for her. After about 15 months, this is mid-2020, during COVID quarantine, she came back. She had gained a lot of weight. had stopped all her exercise, and like a lot of us during the quarantine, did not stick to a good diet. Her A1C was now back at 8.5. Again, we started her on her regimen. This time, the symptom that stood out to me, and I remember Dr. Joe's from the past, was the excessive thirst. So we started her on bryonia. A few months later, we went to Naturomur as her symptoms indicated that remedy. Over the course of 2020, we were able to improve her health and bring her A1C down to 7.2. She had surgery last month in her right eye and is now in a good place. Both her eyes are very good. She can see well. Now, is she going to continue treatment or take a break again is really unknown to me at this point. But I think something to mention for us, all of us homeopaths here, is not to take it personally when a patient stops to come, because we really don't know, what are the other factors that prevent them from coming to treatment. Is there still time for me to talk about one more case?
Okay, you can take.
Oh, yes.
Okay. For my last case, I'm actually going to talk about a male I'm going to refer to him as IB. He's 63 years old. He came in December 2018. He had many, many complaints. He had diabetes over 10 years. He was on insulin 2 times a day, along with many other medications. His A1C was at 11.3. He had had prostate surgery in the past and now had pain in the lower abdomen after that. He had hypertension for 7 years, was on many medications for that. He had had 2 angioplasty surgeries. He had some issue with his ear, so he had some surgery in his ear canal as well. And there was some scar tissue for that. He had surgery again. He couldn't even remember which nose, but he had nasal surgery for polyps also in the past. He had had disc herniation in his cervical spine and pain from that. He had some constipation and digestive distress with many foods. His sleep was bad. He would go to bed every night around 10 p.m., would wake up around 2 or 3 a.m. and lie awake till early morning. Then he would be very tired to get up to go to work. He was a very irritable person. He told me that himself. And he had a severe fear of heights. We started him on Nuxmom 30C. Within 2 months, his abdominal pain improved. Digestion was better. No more constipation. Sleep was also better. He woke up less nights now. But he also did something to his back at this time. While working out, he pulled some muscle in his back and he was in a lot of distress. So again, we had to stop treatment and go to treat his acute. He was worse from first motion, but better from continued motion. So went to Rustox. After a while, he returned with the sleep issue. We came back to Naxwamika for a while. Once this settled, we started having more heartburn issues. But this time it was with more burping. Carbo veg was given. A couple of months of that and the heartburn was gone completely. Now he had been cured of a few complaints. He was more open to discussing his diet. Earlier, he was very resistant, very stubborn to listen to anything. He was strongly opinionated. He believed he had to eat every 2 hours, and he thought that that was the right approach for him to handle his diabetes. I recommended he watch some YouTube videos on fasting, put out by a doctor who I really respect, Dr. Jason Fung, who I'm a big follower of. Incidentally, for those of you who don't know, Dr. Jason Fung is a world-renowned nephrologist located in Canada. And I really believe in his ways. Being a nephrologist, the people who come to seek treatment with him are people who are in the last stages of diabetes who are on dialysis. He takes people who are in that stage and brings them to a normal A1C, stopping the insulin, stopping the metformin, and reversing diabetes by using the methods of fasting. I highly recommend for those of you interested to go on YouTube and watch his videos and possibly read a couple of his books that I also refer to this patient, the Diabetes Code and the Obesity Code. He did read these books, this patient, but He forgot who told the books names to him. He came back and he told me all about the books he had read that he heard from a friend. Didn't really matter to me. I kept my ego in check. Anyway, he started fasting, which was the good news. He followed first to 16:8, and then he did some longer fasts. Over the course of the next 18 months, his fasting combined with homeopathic treatment, we were able to see some really good results. First, the doctor reduced his insulin to once a day. Then after a few months, he was taken completely off insulin. Eventually, he's been able to get off all his meds for diabetes. Over the course of 3 years that I've treated him, his HbA1c is now at 6.1. He's completely off all medication for cholesterol, hypertension, nothing. He takes no medication except homeopathy. Since he had no active complaints now, we are treating him miasmatically. And the last remedy that I've given him was Tuya 10M, which was about 2 months back. With that, I come to an end of my presentation today. If you have any questions, I'm happy to answer.